Hello, myself Dr. Nirmala Vaze. I am a practicing obstetrician and gynecologist for nearly 45 years and I have been trained in UK also. The first time when I had my breast cancer, that was in 1988, the lump was painful, so I never thought that it will be cancerous. But it turned out to be cancerous, and the way I reacted, even my friends say that you are lying, but I'm not lying. My first reaction was how to take care of my family and how to take care of my kids. And you will not believe that when I called my children, they were about 8 and 10 years old. The first thing they asked me is, Mom, will you die like our auntie died a few years ago? And then it clicked me, I have to survive for my children and for my family, and I have to start doing some awareness program because I belong to Nagpur, and in Nagpur at least there was no facility for counseling or awareness program at all. And that time I had to go through all the surgery, chemotherapy and radiotherapy, and good radiotherapy machines were not available in Nagpur, so I had to go to Mumbai. I was really lucky because my sister's house was there in Mumbai and I could stay with her. I had lots of problem during chemotherapy, but every time, I was looking a very positive way. 12 chemotherapy cycles I had to take. That was I was told by the chemotherapist. Then I used to say, okay, 12 में से we I have finished 10, I have finished 8, and only these much are remaining. That's how I could get along with chemotherapy. I had to take lots of tablets and injections for to stop my vomiting. I had my hair loss also. But every time I used to think how my children will survive without me. So I told them that I don't know how long I will survive, but we all have to cooperate with each other. I need a lot of cooperation from you, and there will be ups and downs in my life, which were there. But then every time I told myself, no, I have to come out. Because what I feel is, friends, if God says that you have to have a cancer, so which cancer will you choose? I would always say breast cancer because this can be diagnosed very early, and if you go to a doctor, get it confirmed and diagnosed and treated very early. Dr. Badwe, the HOD of Tata Cancer Hospital, says that 80% of the women can live up to 80 years of age. What more do you want? And every day it's a bonus for us. What happens if you're walking on the road and if you die of an accident? So there you don't get any warning. Here at least I have got some warning, and people do get some warning, and this is not disturbing your body system. Yes, but I mean some ladies will have the mastectomy, some ladies will have the hair loss after chemotherapy, that is true. But then it is treatable, and as I said, you get lot of breast prosthesis. When I used to come back to the clinic every time after chemotherapy, my patients will say, Madam, you are changing your hairstyle every time. Whenever you come, you go out and you come back, your hairstyle changes. How do I tell them that I've tried all the different wigs? But whether they came to know about my diagnosis, I really do not know. But I didn't bother, and I think one should not. Who told you and how you came to know about all these things? I think we have to get along and move forward. That is my message for the whole public.